welcome to At the Table. This is my good friend Kelly Kimball here, Dr. Kelly Kimball, and we'll be having an important discussion today on patient consent and coming at it from an angle of both what it's like to be a provider who advocates for patients as well as the patient side of it and what it means to be a provider who's also been a patient who has not had proper consent in their care.
Yeah. This really starts even back to my chiropractic story as like a very, very young child. I was really sick as a kid and it felt like it was unexplained. I went to so many different doctors and specialists and they could not figure out what the issue was. I had a lot of breathing difficulties. I was constantly getting colds, even cuts and scrapes and bruises, they wouldn't heal very quickly. And so I was having these obvious problems, but I could pass an asthma test. I didn't have any strange immune functioning stuff that came up on blood work. They tested me for so many different types of allergies and nothing really remarkable came up. And it felt like if I didn't fit into the flow chart, then you just don't get care. And this is my experience when I was just 5 years old, 5, 6. I remember being in first grade and being so frustrated. There was even one time when a doctor, I was 6 years old, you're very conscious and aware of your surroundings, but a doctor had even said to my mom that, I think she's just making it up.
Oh,
It's such a problem because it starts with this premise that I think not everyone in Western medicine has, but a lot of Western medicine has this premise of we can figure it out. And if we don't know what it is, it's not real or it's not there.
yeah. And I don't think, to be honest, that happened when you're 5, 6. I still hear stories about this every day. And I've
Yes.
experienced it myself. Just to preface on this for anyone who's listening, like when we make generalizations, we're all going to agree to accept that there's also exceptions to this rule, right? There's really amazing providers who are the exception, but we're looking at the healthcare field as a whole, and that this has been a problem since you were 5. And I literally had a new patient yesterday I was talking to, and she's like, a lot of people don't believe me, is the first thing she said. And I was like, okay, my promise is I'm going to believe you, which is, which was wild for them, but that should be bare minimum.
Yeah. And I was so frustrated. I felt so ignored. I felt unheard. And I was so young. And I remember being in first grade and being like, I will always listen to children. Like, I will take them seriously. And certainly, kids can be silly and exaggerate and all this stuff, but like, I'm going to at least start on the premise that they're telling the truth and then discover and uncover more. And I think that there's a lot of vulnerable populations. I think kids are one of them. I think that women is a big vulnerable population. I think pregnant women is a big vulnerable population. And if you think about it, I'm talking about fitting into a flow chart. Those flow charts in Western medicine come from research, and we do not research women, kids, or pregnant women. And so there's fewer boxes to fit into.
Oh, that is such a good point, Kelly. I feel like I also see it a lot with autoimmune issues.
Yeah.
Or one of my favorite books, an entire book on like exactly what you're talking about. And this woman goes through her experiences of going to doctors and no one could figure it out. And so the end result was always after a doctor visit, after it was like certain months with them. And then they got to the end of what they knew and they were like, it's probably in your head. And then she goes to the next doctor and has the same experience. And it's not just like traditional Western medicine. It's actually, I notice it in a lot of different parts of medicine in America specifically.
I think it comes from a desire to want to help. And I think it might be a bit of a coping mechanism of like, we want to be able to help, we want to have the answer. And if we can't find the answer, it's like a coping mechanism to say, well, maybe there's not really a problem. And I can have empathy for that situation, but I think that this is happening on too large of a scale. And all of those populations I just listed off, like that's a ton of people. That's basically everything except adult men, because adult men that's who we research. And, there's a lot of medicine that's not based off of evidence, and that's okay too. a lot of medicine is based off of clinical experience. I think it's just like important to know when that's the case versus when it's research. And and most importantly, if you don't fit into the flow chart, even just having some empathy for the situation can be helpful. Like even if someone had said, this is really hard what you're going through. We're not really
Mm.
sure what it is, but this is really hard. I think that some sort of validation is very helpful. And so I have a big heart for working with people who do feel ignored and who feel like maybe they have had negative medical experiences in the past. And, I feel like called to work with that population. And that has led me to some of these other populations like kids, pregnant women, and just women more generally too. But really anyone who's felt like they haven't been listened to and need to be listened to.
Did anyone find out what was going on with you? Like, or who helped you the
Well,
most in this situation?
yeah, well, honestly, I kind of we hit a point where it was like it was so many doctor's appointments over and over and over and over. And we kind of just hit a point of like, I guess this is it. I guess I'm gonna have to live with it. I think that I really internalized this message of it's your body that's broken. I was born early. They're
Mm,
like, maybe it's because you were a preemie. They said maybe it's because you had pneumonia when you were really young. Maybe there's just some lung damage and it was just like
just
I
grasping at
think you just
straws.
gotta live with it. Yeah.
Oh,
It
gosh.
was kind of a fast forward until I think it was right around my 16th birthday. So I was either 15 or 16 when I shadowed a chiropractor through a job shadow day program at my high school. And I hadn't really been interested in patient care because of my experiences, but I had been interested in science and research because I was like, I just need to make this better for people. And maybe if we know more, we can do better.
Mm.
And so I'd been interested in research and this idea that like if we know more, maybe we can help people. And so when I shadowed this chiropractor, it was assigned randomly. I had done the program a couple of times, but they gave me that interest because I had indicated I was interested in like science. And so this chiropractor explained chiropractic to me and it just like I fell in love with it instantly, and I felt like my brain kind of like just exploded with how different the perspective was because it was all about helping the body heal from within. And it starts on the premise that your body knows what to do, even if the doctor doesn't. And we are just trying to help your normal healing process work more efficiently and help it work more effectively so that your body can do its thing and your body can heal. And that was a totally different message from, you need to have these constellation of symptoms or these findings to get care. Like I could always pass an asthma test, but I still couldn't breathe and I couldn't run in my gym class when I was in first
Mm.
grade.
Yeah. So
But
you're taught to like not
yeah.
trust your body at all. Like your body, I feel like the message often in that your experience in those 10 years ultimately leading up to meeting a chiropractor was don't trust your body. There's, or even yourself and knowing if something's wrong with you or not, because there's such a discrepancy on like identifying what might be wrong and your body healing. And then being able to go into a state where someone was like, no, your body's really smart and can heal was probably like, were you just like, I picture it as like this moment with like light shining down. Ah, I can trust my body. I can like, it's like finding back home back in yourself.
Yes, it was amazing. It was just like I said, I felt like my total world shift, like the ground shifted and it was something that was so uh in a way like pre-assumed that the body heals and I didn't even realize that I had shifted into the mindset of my body's broken. And so to come back to that foundation of my body's not broken, like living bodies are designed to heal. This is what our body naturally does and this is what our body wants to do and is trying to do and we can help it do that thing instead of saying like well like your body's just not really working this way and we don't have a way to make it to force it to do that. And so yeah, it was so inspiring to me. I felt like I was all in on the concept of chiropractic and I had never even been adjusted yet. And so I became a patient and I feel like my health just dramatically changed. I stopped getting sick so much. I was able to run. I actually ran a half marathon.
I didn't know that.
I
That's
did. Yeah, I
amazing.
did. And it was pretty groundbreaking for me, especially because of the breathing issues, which were so
Yeah, I can't run in gym
ingrained.
class to running a
Mhm.
half marathon after
Yeah.
getting adjusted is amazing.
Yeah. Yeah. I just think that it shifted everything and it's almost like it made me believe in myself, made me believe in my body. And it was also, this was a chiropractor who listened to my concerns and didn't discredit them. And I think that was one of my first really positive experiences. And so even from the very beginning, when I envisioned then becoming a chiropractor, it was always about like, how can I make sure that people feel listened to, make sure that they know what their options are. I think that a lot of the times Western medicine recommendations are not given as recommendations. They're like, I'm telling you, and you have to do this. Almost like the doctor saying, I'm in charge of your care, not you. And so my practice is all about making sure people know that they're in charge. And I think that this happens. I see it most dramatically during pregnancy. Many women might be given a recommendation. For example, they're like, we're going to be inducing at 39 weeks. And I go, oh, okay. Like, what is the rationale? They're like, oh, the doctor just says that they don't want the baby to be in there too long. And that was it. And this patient, I'm thinking of one in particular, but this has happened many times, she really didn't want to do this. And, I have gone through like very detailed history with her and all that. I feel like I knew her health very well. Um, and yet knowing also that it's outside of my scope of practice to make a different decision on something like an induction, I just was just there to remind her saying, you're the one in charge of your care. And if this is something you feel really strongly about, you can ask more questions. You could even change providers. I had a different patient at 36 weeks, she changed providers. And this was actually completely without my own involvement, but she's like, I went in to see someone. I really didn't get along with this one provider, and they could be on shift when I'm delivering. So I am switching. And she switched last minute. But there are options. And I think maybe just laying out those options makes people feel empowered. It increases that space between stimulus and response of saying, this is the stimulus, and then the response is so quick, like I have to do this. I just react. I love that quote that freedom is the space between stimulus and response. And so increasing someone's freedom gives them more power to choose and just reminding them that they are the ones in charge.
There are so many amazing things you just said there. I agree with you. Just to like confirm with the patient experience, and there's some interesting studies in like the sociology world actually on how you're raised even can give you this ability to question authority or not.
Mhm.
And we're taught how to respond to authority literally when we're children. And they did the study of different people who come in and bring their children to a pediatrician and say, hey, tell about your problems, or you sit there and be quiet and they're going to tell us what to do. And that can dictate someone's health experience. That this topic's so important because it's so multifaceted too. It's like we're conditioned to trust authority, but that trust comes with trust of they know how to help us best. And so I'm going to be the good patient. And this is where I think a lot of people come from. I'm going to be the good patient because I'm conditioned to do this, but I'm going to be the good patient and I'm going to listen. And I know even if I'm frustrated, they just must have bad bedside manners, but they're a good doctor.
Right.
I hate that saying because
Yeah.
I just think a good doctor is one who makes you feel comfortable. Your bedside manner is almost as important than the treatment you give. And idea like healing can happen when people feel heard and empowered. Their body naturally gets better. Like you release different chemicals versus if you feel disempowered. And in a way, I think when you're not given options, it's abuse in the medical world. I would go as far to stand on that. And I think mostly abuse happens to women. And number one area is pregnant women. When you're talking about this, as when you were discussing like, oh, these patients that have this, I was literally like, oh, I can list off patients I've had who they're told this is the treatment I recommend. but they don't say it like that. They're like, this is the treatment you're going to have. Pregnant woman is definitely like, this is when I think you need to have the baby. So therefore we're going to make sure that happens. And so many women are like, no, I want to go into labor naturally. I want to like at least get to 40 weeks and like see if my body does what it's supposed to do. And they're
Mhm.
like, take that option is taken from them. And they're not
Yes.
told why, because that's my first question. Hey, why are they choosing that? Is it a safety concern
Right.
or not? Like that's going to be the number one thing you need to know is why is this being recommended to you? And I also see in the
Absolutely.
fertility world, I have patients who are told this is your only option to get pregnant. You have to do it this way. They don't even tell them what's wrong with them. They're just like, this is how it is. Go do IVF. And they're not telling them all their options and helping them make an informed decision. And so it is in women's healthcare on an insane level.
Yeah. And, I would go so far to say that medicine has become so siloed. I don't even think those providers are aware of all of their options.
I agree. I agree. So that actually leads me into a question on I feel like something that's happened is this movement of evidence base, which
Mm.
I am not against when I when I say this,
Right, right.
but it's so more complicated because there's these buzzwords that's thrown around, right? And but when we dive in deeper to how they show up in practice, it gets dicey. And so you look at something like evidence based. And then it's like, well, we only do evidence based things. And then the question comes to what you brought up earlier. What happens when there's lack of evidence? And instead of saying there's just lack of evidence, let's go to the next level, maybe practical, like what we've experienced in practice. And so now lack of evidence is being used as pseudoscience promotion
Mhm.
versus actually talking about options in here's what we've done research on, here's what we've seen in practice, and here's what maybe has been disproven in research is a very different conversation than it's not evidence based, so you should never do it.
Yeah, I feel like I really agree with you on the evidence stuff, and I love research. I've done research. I think it's so much fun. But it is limited. Research is ultimately limited, and a lack of evidence is not evidence against. It's not evidence for, it's also not evidence against. It's saying we haven't studied it. I think a lot of the times they're saying, if we don't have the research, then we don't recommend it. That may not be true. I've also heard people say, I mean, that's one issue when there's no evidence. There's
Mm-hmm.
another issue when there's no RCT, a randomized controlled trial. I took a great evidence course in undergrad on how to really critically evaluate a paper. And you can tear apart any research paper that you want, but it's all about knowing what matters and what doesn't. Like, no paper is perfect, no study is perfect, but what flaws matter and what flaws kind of don't. And that was one of the most useful classes I've ever taken, just full stop. And one of the things that they talked about was just that it doesn't have to be an RCT, that randomized controlled trial, to be a strong recommendation against. And a good example of this is smoking. We had enough preliminary evidence, and we didn't work our way up to the RCT as far as like study design, because in our preliminary evidence, we found that smoking is so dangerous. It's actually unethical to randomly assign some people to smoke. It's never been done. So, do we know smoking is bad for you? Absolutely. Is there a randomized controlled trial that to say that smoking is bad for you? No, there is not. And I think that is just one of the best examples of you don't need an RCT to actually prove and know something. And on top of that, these are two separate issues, like the primary like bowing down to the RCT studies.
Mm-hmm.
And then there's the other issue of saying, if there's just lower quality evidence or even not a lot of evidence, there's still clinical experience, and that's not nothing. It's not trying something that's never been done before. And we can rely on that too. It just gets factored into our decision making as a whole, what kind of experience and what kind of evidence is out there.
That's very well said. But that's one of my favorite things about you is like you have a very unique story on how you got into chiropractic, and it being a research ultimately is evidence, like, or the lack of evidence um, in traditional medicine, and the lack of ability to help you when you don't fit into that model, leading
Mhm.
to you also being like a very, because you did research when we were in
Mhm.
school, and you still continue to be very involved in, I feel like, understanding research and applying that to your clinic on a pretty regular basis and how you practice. And I think chiropractic gets a lot of misinformation out there that
Mhm.
it's not evidence based. When, yes, there are plenty of things that are evidence based, but certain things you just can't do certain studies on. But there's so much clinical studies out there that are really showing the validity of what we do. It ties into another issue, is even when evidence comes out, are doctors actually changing? We have to look at providers in all fields. There is own subjective, as much as we want to say everything's evidence based, there's so much subjective viewpoints and coming in. And part of it is that isolation as a provider. Is It's like, I talked to a midwife once, and she gave this great example where if you're an emergency room doctor, you're going to think that certain things are always, like, a home birth's always dangerous because those are the only home births you see. Now, the studies don't show that, but it's going to be very hard, even with a proper study showing that home birth is perfectly safe. That doctor, because that's all they see, is
Mhm.
going to say it is unsafe.
Right. Their
And
personal experience is that
mhm.
it's unsafe.
And as much as nobody wants to discuss it, that does trump for a lot of people in their decision making. It's going to trump
Yes.
any study that's out there, no matter how evidence based and perfect it is.
Yeah, yeah. And I also feel like it's an important distinguisher that true evidence-based practice is emphasis on the based. Like the true evidence-based model is to use evidence to inform, but not to be the only thing. I just think how it gets applied in practice by people who, champion the name evidence-based practice, sometimes they take it too far. And so not everyone does this. And the true model is actually very nuanced and incorporates patient values, incorporates clinical experience too. But what is so interesting about what you're saying of like the personal experience, it's going to trump the evidence. That is just the human condition. Like even if
Mm-hmm.
we think we're not doing it, we are. And we can be more effective if we know that we're going to do that.
Oh,
Right?
yeah. Yeah. Like, I'm aware of it sometimes. I'll have to be like, oh, this viewpoint is so different from my personal one, but I have to meet that person where they're at. But if you can understand that your world experience is going to impact your practice,
Mhm.
you can also be aware of it and stop it from happening, actually, at a bigger rate, I think, than if you pretend like that never happens.
Right. Yeah. It's kind of like being aware of your own bubble. Like I
Mm-hmm.
know I live in the chiropractic world and the holistic health world, and there, that comes with a certain perspective and set of experiences. Like I work with some people who choose to be here because they want that model, and some people who have been forced to be here because Western medicine couldn't serve their needs, and they don't even want to be here. They're reluctantly in this camp with us. And so, I recognize that I see more people who have felt harmed by Western medicine than maybe other people do. And even just the awareness of that is important too. I think that it always matters, but I think that my experience is always colored by that too, by my own personal experience and by the fact that these are the patients who I see. And I also think it's the type of patient I attract because I think I really have a heart for working with people who are nervous about chiropractic too, because I am really diligent about this concept of informed consent and knowing what options, even down to adjustment to adjustment. Like yes, someone says they're ready to be adjusted, but I will even ask and give options like, oh, here's a couple techniques I could use for this adjustment. Do you have any preference today? And even if there's one recommendation over the others, I'll give it, but I'll always ask what their preference is too. And that takes time. My appointment times might be a little bit longer than other chiropractors because of that, but it's so worth it to me. And I think that, it's really appreciated by people who are nervous for any reason, which are people who've had maybe some of these negative experiences, but also new parents, especially when I work with babies. They're so nervous and they want to know
Yeah.
everything and know all the options. And I'm so happy to walk through that with them And even sometimes if they're just like, you know, we can do this one adjustment. I'm a little too nervous. Let's just try that for today. And that's fine.
That's such an important thing to note too, because I agree with you. Like I always tell new patients, I actually love first time people who have never had chiropractic because I'm like, yes, we can do this together and you can like see what's amazing. But with that nervousness, I think when you do give people options and they realize, oh, I can pick, right? Like I
Yeah.
think a lot of people, because of their experience in other places, they assume like we're gonna do whatever we want to them
Mm,
and adjust them however they want. And so that's where I think a lot of that nervousness comes from. It's like, what if I don't want that? And what's that going to be like when this thing is forced upon me? If you don't want this section of your spine adjusted, we don't have to do that right now, or we don't have to do that on every visit, and meeting them where they're at and recognizing you can also say that you hate something. Like I always give them that
yeah.
permission. If we ever do an adjustment, you're allowed to say, I absolutely hate it. I think we do 11 techniques altogether. And
Mhm,
it's like, we have so many other options for you. But if I
mhm.
don't hear that, you don't like it, then you'll leave and be like, oh, that didn't work. Or I wasn't happy. But it's strictly, I need you to speak up too. I don't think any provider ever told them before, hey, you're allowed to say you don't like something I did. I'm like, I need you to tell me. I need to know. Um, Even if you liked it, like either way. But because this is something I think we both advocate for a lot in practice, I want to go into because this does happen primarily to women and children. And I'm not saying
Mhm.
men don't have this experience, but when I talk to patients, it is almost every woman has had at least one provider who's treated them like they don't know anything, or don't have a say. I've had this happen even in this past year. You've had this happen in your lifetime. Um, what do you recommend for women? Like, what are your tips for women when seeking providers? And how do you think that women can advocate since this has been happening since you were six, as your first
Yeah.
experience, right? But
Yeah.
I do have a belief that if more women start advocating, it'll force the system to change.
Oh, yeah. You know, I think that the things that we can do require time and resources. And
Mm,
that is a really tough thing to accept because um, the recommendations that I've, even looked into for myself and chosen to do sometimes they require time, energy, and resources. And we don't always have that. But I feel like our best options are to always go into this environment with whatever doctor you're about to see, with the mindset of what do I need and do I have time? Is this an urgent need? Do I need to get something done today? So or do I have time? I think that especially with something like primary care, if it may not be as urgent, like finding the right fit is valuable. And
mhm.
it might cost money, to go to a doctor and be like, this is just not the right fit. I'm not going to proceed. And even just going in with the attitude of, I don't have to do anything that this person says. You ultimately don't. You can always walk away and find something else that may come at a cost if you're dealing with some symptom that you really want addressed. You might have to weigh that cost benefit for the
Mhm.
time. But I think that even if you're able to choose it, saying like, hey, like I have this need and I need it addressed now. And even if I'm not liking this doctor, I just need to get this done. Being able to recognize that and then choose it is is going to feel so much less traumatic than if you feel like you went in and you didn't get to choose and this doctor pushed something on you and you did something. And maybe you would have chosen it anyways. It's not choosing in the moment is a big difference for total experience. And so going in with that attitude, where you do have the ability to have time and space and you might be able to wait. You could go in for almost like a first interview of a doctor. Sometimes you can even schedule it that way. Those are not usually covered by insurance, but you can actually schedule it that way. Or you could go in for a sick visit or whatever it may be, and just have to go again to someone else. And I think I think it's worthwhile to find the right fit where you have the time. And when you don't have the time or capacity, or you're in the emergency room, just recognizing like I can, my options are like, what would the benefits and costs be to walk away versus what are the benefits and costs to just going through with it right now. I think those are all really important.
You bring up a good point is the cost for sure for a lot of people. I do think when you go in though, one of the things that came up with us is that a lot of providers don't realize that they're
Mhm.
not giving people options. So I always tell patients like come with a list of questions and be prepared to like be like, I'm gonna sit here till I get my answers. And so be a little like stubborn and difficult, not in like rude way, but in a way of like, I'm paying for this visit. It does cost a lot. So even if I'm seeing a provider I don't like, I'm going to at least get answers and ask questions such as, what are all my options? I know what you recommend best, but what are my other options as well? If I didn't take that, what else could I
Absolutely.
do? And are there any other providers you recommend that I should be seeing for a condition, especially for like one of the things brought up is like the autoimmune or like chronic conditions where you're sick, but nobody will admit that you're sick or can't find a reason. Like when you don't fit in the box, like with your story, I
Mhm.
think that persistence of who else should I see, recommend me to people, what tests have you not ran, asking those questions that are really, I think it's uncomfortable also for women to advocate for themselves because we're not really, like talked about earlier, we're not taught to do it. Um,
Mhm.
and I feel like I'm pretty bold and I still feel uncomfortable sometimes
Mhm.
because that authority figure is real, it really does put you.
Yes.
But like, I think changing the framework of you're paying them, so therefore they work for you. So you're allowed to ask these questions. You're allowed to, and
Yes.
enough people keep coming and asking questions, they're going to be better prepared for it, and willing to answer as well.
Yeah, I think that that is absolutely great advice. I think that I mean, I'm also a pretty direct communicator, and I think that I have also just been in the seat where I feel so intimidated, even by someone who's being kind of like subtly pushing forwards or something like that. I just had a patient the other day talk about their newborn daughter has a tongue tie, and they went into a well visit. They said they didn't want the tongue tie released, and the nurses start talking about all these reasons why they should do it, and then they bring in all the equipment and they start going to do it, and they're like, no, we said no.
Oh my
And
gosh.
I think that there's almost a little bit of like social manipulation of they didn't really ask, they just started doing things, and it's they were able to stop that situation, but it was only because they had thought about it in advance. This is something they were talking about with
Mm-hmm.
me after the fact. And I think that it's it's so hard when you have that social pressure or things are a little bit more subtle. It's like we're having a confrontation, but no one's arguing. Like we're being
Yeah, it's like, well, they
polite.
didn't say no, so it must mean yes.
Right. Yeah. And I mean, or even in this case, the patient did say no the first time, and then they're like, well, we'll give this persuasive stuff and you must be persuaded now. So we're just going to proceed.
Mm,
So I think that trying to be very aware of that social dynamic, like having these questions, super important. If you feel like you're not a confrontational person, or that confrontation is going to be too much, then you can, have a prepared line of being like, I'm just not feeling like this is the right fit right now. I think we're going to end the appointment or something
mm-hmm.
like that. And on the flip side, if you feel like you are a little bit more on the confrontational side, you can always ask that your response be documented. Just for example, I've had like low vitamin D in the past. I was on a higher dose of vitamin D, and I wanted to see if I should still keep taking that. And the doctor I was talking to did not want to test. They did not want to do it. They're just like, I'm sure you're fine. Just stop taking it. I was like, well, I really want to know. And it's a simple blood
Mm,
test. And they wouldn't order the labs. And I remember talking to a colleague of mine about this experience. And one thing that she told me, she was like, what you can say is you can ask them to document that I asked for this blood test and that you denied it, and have that documented that I did ask for it. And obviously, that is a little bit more of a confronting interaction, but it can be helpful because medical records do follow you a bit, and it can be helpful to kind of chart that down, and also make the provider kind of take a beat and think about what they're recommending as well, if
Yeah.
they're willing to do that.
Or not willing to test. I also think like, especially when the patient's paying for it, like let them know how much it is and order the test. Like it's not harmful to
Mhm.
order the test. You make such good points with that is making sure it's documented. But even for people who aren't really, I do think another thing is you could bring a person with you, like a friend. You're
Yes.
allowed to have someone go. You're not for like nobody should make you be like you have to be in this room alone and go through this. You know what I mean? You're allowed to have a peer with you, your husband, your friend, your mom. Like if there's somebody else in your life who's I would like it's like with having a doula, right? Like they're there
Mhm.
to advocate for you. Sometimes if you're really struggling and you're really looking for answers, bring a friend who's like going to be like your doula for your health world and have them have the questions that you need asked. And if they can ask for you.
Yeah, yeah, absolutely. I think that having someone there with you is so important. It was something that I really kept to while I was pregnant. Like I had my husband come with me to a lot of my appointments, and I started out in a hospital system, and I just felt very nervous there given my past experiences. We ended up switching to a birthing center halfway through my pregnancy, which was a place where I did feel more comfortable, but especially at the hospital visits, he came with me to every visit. Um, and there were even, I mean, this seemed, let me preface by saying this should be completely unnecessary. However, it has been my personal experience where, Megan, as you know, I have some severe allergies. And there was one time when I cut my finger, I went to urgent care because I needed stitches. And as they're stitching up my finger, I feel a pinch in my other arm, and they had given me a tetanus shot. They didn't ask, this was an urgent care center. They didn't have any of my health history. They didn't know any of my allergies. It was a very scary situation for me. And they didn't ask for my last tetanus shot. This should never happen. Let me preface that, like, this should absolutely never happen. I think any, you know, doctor would have the same gasp that you had at this situation. And it just shouldn't happen. It does happen. And so when
It
I walked
does.
into every single one of my prenatal appointments when I was pregnant, it was summer and I wore long sleeves down to my wrists because I was so alarmed by this past experience of what had happened. And I
I
said
mean,
to my husband, I was like, you need to be on the lookout if anyone comes at me with a needle or anything else.
I mean, Kelly, that's assault.
It is.
It's assault in every way. Like you had something done to you. That's very violent. I mean, and you do have allergies, but even if you didn't, it shouldn't negate the fact that should never happen to anyone. Like no one should be given a shot, no one should be given medicine, no one should be given any treatment until they consent to that treatment. And
Yeah.
if they
Oh,
do not
chiropractic
consent,
adjustment too.
yeah,
In holistic healthcare, in Western medicine, in all of it. And it's remarkable. And I can have some recognition that this is not some doctor just trying to be cruel or negligent. I
mhm.
think it comes out of overtired, overextended doctors that are just they're moving really quickly. They have to get it done fast. They're like, oh, someone's having stitches. They're going to need a tetanus shot. I've got 5 other rooms open and I just have to get this done. Boom. And that's where things get missed. So it is a systemic problem. I think
Oh,
that Western
absolutely.
medicine is full of great people in a system that is designed to bring out the worst in them.
Absolutely. I'm sure whoever, okayed all that, if they might, even if they've heard the story, be like, wow, I can't believe that happened. That's,
Yes.
like you said, it's not an attack. I think that should be really clear in this talk. This is not an attack on individual providers. There's always a few that suck, but as a whole, I really do
Yeah.
think people go into medicine with a good heart, but the exhaustion and then with exposure, you get desensitized.
Mhm.
I think as a provider, it's vital that you do the work to at least recognize that you might be desensitized and this is someone's first time experiencing certain things. Or even though you might see pain all the time, for this person, this might be their first time in pain like this, or going through certain experiences. And so having that viewpoint's important. But I mean, it does come down to a system change. But I think the conversations are going to be a big part of changing that system, right? Like it's talked about, I think, in smaller doses And there are books I've read on the issues, but it's not on a big enough platform still of conversation on the abuse that does happen to women in healthcare.
Mhm.
Because I think partly it's really uncomfortable because even when you do talk about it as a provider, technically you're a part of this. If you're in the system, you're a part of it, whether you want to be or not. But you can also be a part of the solution.
Yes, absolutely. I mean, I do think that ultimately doctors that are not well liked are they're going to leave. and and I do think that again, a lot of this is created by the system, but like there is a lot of there is a lot of fallout of people leaving medicine and leaving healthcare, maybe because the system, because and because it might create the situation where they feel like they have to be giving poor care. I also think that patients will leave when they're able to. I mean, it's such a difficult thing because not chiropractic alone, but healthcare in general defies the laws of supply and demand. It's there's never this is actually another element going back to my undergrad. I took a class on healthcare in America and this healthcare systems. And one of the big themes of that class is that healthcare defies the laws of supply and demand. You can open a hospital right next door to a current hospital and you can fill both. And
Mhm.
it's and because of that, we can have these like tough systems perpetuate. But I do think that doctors who take time and care to listen are they are going to be just attract people and just have a lot of success. Um, and it's the slow soft skills way of moving forwards, but I think that it is happening. I see it. I've seen the shift, and I it makes me happy to see that shifting.
Yeah, that is really exciting that things are changing. And I think conversations like this are going to help that change too.
Yeah.
So we are coming to our end of our time. Is there anything you want to leave the listeners with?
I think that the kind of the summary point of my own story and what I feel like every single person needs to hear is just that your body's not broken, that your body is always trying to heal. And I think that healthcare is hard and health journeys are hard, and there is always going to be a path forwards, and don't give up, keep trying.
I love that. Thank you so much for coming on and joining us at the table.
Thank you.